used to connecting with Mission Services of London in the spring every year for our annual general meeting. Unfortunately, we've had to postpone that meeting until September 30th this year because of the COVID-19 crisis. And with that, I know you have lots of questions about how we are supporting neighbors in need and our essential staff at this time. So I've brought some of those questions to our Executive Director, Peter Rozeluk, today, so he can share his thoughts and some information with you. So let's get started.
So how have we been coping? Actually, I think we've been coping quite well, and there are at least three reasons for that. The first is that we implemented and began with our pandemic plan. The second, funders have been extremely supportive of all of our programs and what we've been trying to do. And thirdly, we've been very fortunate. So from the beginning, we were implementing and following Middlesex London Health Unit requirements and guidelines. So we've been doing additional cleaning throughout the organization. We've been physical distancing, and we've had to make some changes to some programs. So to more fully answer that question, I wanted to highlight at least two changes that we've experienced here. And the first is really social distancing and moving people out of the men's mission and out of Rotholme into a hotel. So the only way that we were able to social distance is actually reduce the number of beds in the emergency shelter and at Rotholme. So we've moved half of the families into a hotel, and we took about a third of the men out of men's mission and moved them into a hotel as well. So the problems with that, the practical problems are basically it's a third location that still needs to be staffed. The third location doesn't have food services there, so additional pressures on our kitchen. So we've had to hire extra people in the kitchen in order to provide the meals and transport them over to the hotel as well. So that was one of the big changes, and that change in itself creates anxiety for families, for parents, for children. But what we've tried to do throughout that whole time is what we've always done, is try to provide a listening ear, providing some guidance and some help, and trying to reduce the level of anxiety of the individuals that are using our services. The second big change is moving to virtual communication. So I know that community mental health programs, that whole program is designed and based on meeting people face to face, on dealing with them where they're at, and of helping them walk through and get the services that they need. So that was the biggest change, because they weren't able to meet with people face to face anymore. So they've had to use phones, text, Skype, Zoom, all the new technologies, whatever really it took to meet with their clients and to provide them with help. Quinton Warner House similarly has had to provide more virtual assistance in supporting the men that are in the program, in addition to actually staffing the on-site residential treatment program as well. So they have coped remarkably well. At Quinton Warner, we've changed the annexes, and one was used as sort of like a quarantine coming into the program, and the other was used in case we needed to isolate people. So there have been, and because of that, we've had to reduce the number of men that have actually been in program. But nevertheless, over the last couple of weeks, we've opened that up even more. We've admitted several more men into the program. We've had a couple of graduations, so the staff again have done remarkably well under some very trying circumstances. And the third component of virtual communication is really at the admin office as well. So finance and development, those two teams almost went entirely virtual, working from home, again meeting with donors and supporters through Skype and through Zoom, texting and phoning. Finance has been able to continue to receive the donations that have been so graciously provided to us, and so we've been able to carry on. So as the pandemic evolves, our service will continue to evolve. The way we're providing those services will continue to evolve as well. So when all is said and done, I am just so very grateful and thankful to be working with an extremely dedicated group of staff throughout all of our branches. So what changes do I see coming in the near future? I wish I had a crystal ball. That's really difficult to predict. All I can say is that we will continue to follow provincial guidelines as provided by the Premier. We will continue to follow Middlesex London Health Unit guidelines. We are in regular and frequent contact with the Middlesex London Health Unit and the City of London and other London Homeless Prevention Network agencies who are serving the homeless here in London. We will continue to do that. And what the future holds, we really don't know. And as Amy mentioned earlier, our annual general meeting is postponed. We would normally have that at the end of June. And we are postponing that to September 30th. So our preference is to have that meeting in person. We would like to see you face to face, but we won't be able to make that decision until later this summer, and we will keep you informed of that. Certainly we would want to celebrate our successes in person, but if we can't, we will do the next best thing and still celebrate with you. So what's happening at the Mission Store? I'm really happy to say that the store is open again after being closed for a couple of months. What you'll see has changed when you come shop is we've really implemented a lot of the restrictions that other retail establishments have as well. So there's a limited number of people in the store at any one time. We've got the physical barriers between the cashiers, the clerks, and the customers at the cash registers. We're doing an awful lot more cleaning in the store as well for health and safety reasons. But the store is open for you to come and enjoy the shopping experience. Our voucher program has also been reopened as well, and so we're really excited about that, to be able to provide that program and service to individuals who are looking for a fresh start in their new place or looking for clothing. Our clothing and household item donations are being accepted again as well. So they can be dropped off at the back of our building at 797 York Street during business hours. And for those who can't drop things off at the store, we can arrange pickup. If you go to the store's website, missionservices.ca, you can arrange for pickup of your donated items. So with the store now being open, all 5 of our branches, all of the programs are up and running, albeit some a little bit differently than before, but they are all open. So how can I help? There's no question that the pandemic has resulted in additional needs for the residents, customers, our guests, basically our neighbours here in the City of London. And we're responding to those needs as best we can while facing additional pressures of PPE and food and hiring additional staff and having increased cleaning practices. So the best way you can help at this time, the most appreciative right now, would be through online donations. The funds reach us immediately, and that enables us to respond that much more quicker. Responding by providing shelter, responding by providing nutritious meals. So you can give online at missionservices.ca/donate. And I just want to end this by really saying thank you. There is no way that we could carry on what we do here at Mission Services without your help. And so you've been an extreme blessing to the staff and to the people that we serve. So again, I just want to say thank you. This ministry does not happen without your help. Thank you.
Thank you for tuning in to the Q&A with Peter. I'm really glad he was able to answer some of your questions. And as Peter mentioned, need does continue throughout our branches and within our community. So if you are eager to help, please jump online, missionservices.ca, where you can make an online donation, as well as learn more about the different precautions we're taking on the ground at our branches. So thank you again. Please stay tuned to other updates. We'll put them out on our website, social media channels, as well as our Curb Notes newsletter. So until we see you next, take care and be safe.